school 30 years now, and really excited to be part of this conference. So in the next 20 minutes, I will be talking about what next. Okay, next slide. Okay, so we have 20 minutes to cover a very exciting topic. And so Toyin tasked me with talking about beyond the now, what next? And her panelists are set up to really address this. I am a very optimistic person, so I will talk about what could happen next, but I really want us to leave with following up with the opening address, what we can do now to prepare for the what next. So I'll throw out a few things in the world of infectious diseases about what could happen next, but I want us to leave here with what we can do now to prepare better. And the panelists that will come on talking about mental health, financial health, physical health, are primed, and our breakout sessions getting into that part. So my objectives for this 20 minutes are at the end of this session to understand kind of the global and regional impact of COVID-19 in a very small nutshell, describe the host factors that are associated with poor outcomes, and really identify the importance of other infectious diseases and actions that we can take to improve overall health and the aging process. So a few definitions, right? Because we've heard the words thrown out: pandemic, outbreak, epidemic. And so just a few definitions to guide us through the rest of the talk. Endemic is just something that belongs to a particular place or region. And so, so things that are endemic, to a country with malaria, hepatitis B, things like that, that's just something that belongs to a particular place or region. An outbreak is when you start to have a greater than anticipated increase in endemic cases in a single area. So you have an outbreak of cholera, an outbreak of something where you expect that there's something that goes on there, but you're seeing a slightly higher number of cases, and that's an outbreak by definition. When you go to an epidemic, that's a disease that affects a large number of people across different communities, population, or region. And if you remember, for the longest time, the WHO left COVID as an epidemic, and people kept saying it's a pandemic, it's happening in this place and that place. And when it got to a place where it's multiple countries, multiple regions, multiple continents, remember in March, the WHO finally declared COVID-19 a pandemic. And that's because it affected multiple countries and continents and everywhere in the world. So those are our definitions. Now, like Toyin mentioned, epidemics are not new. Pandemics are not new. And there have been predictions, right? So I love history. I love a lot of things. I read a lot. I'm a nerd. But Athens and Sparta, there were epidemics developed then that took out populations. Then we're all aware of the Black Death or the bubonic plague in the 1330s that started in Central Asia, moved through Europe and then the rest of the world, and really through commerce and travel, which was limited then, but that's how that spread. We know about the smallpox, with tens of millions that died in the 16th century. We keep referring back to the Spanish flu of 1917. That was the last big pandemic that we talk about that's kind of in our memory, and where there were over 50 million people killed worldwide. And since then, we've had other things come up. SARS, you guys remember, in 02, 03, then again in 09, MERS, avian flu, Ebola, all warnings of more to come, right? And then there have been films and movies propelled around these things. The film Contagion, which a lot of people watch, which was based on the SARS 02, 03 and the swine flu, about this imaginary virus that would kill 26 million people around the world. And then in 2015 and 2017, Bill Gates talked about if anything kills over 10 million people in the next few decades, it's more likely to be a highly infectious virus. And in 2017, he said it's actually probably going to happen within the next decade or two. And so then we got to COVID. But before we got to COVID, this chart just shows a lot of other emerging infections and reemerging infectious diseases. So I became an infectious disease physician in 1999. And then, some of these things were around, some have evolved since then. And what we know are there are new emerging, re-emerging things that are resurging, and there are things that are deliberately emerging when we talk about things, agents of bioterrorism. So again, in the field of infectious diseases, there will always be job security, but also what it means is that the world is small, it's very global, and one disease somewhere potentially could infect the whole world. So my brief COVID-19 update, and again, I put this slide up, and sometimes when we have numbers, you get fatigued. It's just numbers and millions. These are humans, and these are cases. And for people who've lost people, family and friends and people they care about, COVID-19 hits home for a lot of us. So just a one slide update of just to show the impact of this, there are over 45 million cases worldwide, and that was as of yesterday or 2 days ago, with the top 5 being the US, and I currently live in the US. I've lived in the US now 25 years. If you look at on the continent of Africa, it's developed about 1.76 million cases. And I put Nigeria because a lot of us are joining from Nigeria. Nigeria is number 5 in Africa, right after South Africa, Morocco, Egypt, and Ethiopia. And then Europe, and then look in the US, over 9 million cases in the US. Now, when you look at mortality rates, it's about 1 to 3%. And it's highest in continents with the older population. So the US and Europe have very higher mortality rates. Like the First Lady mentioned, Africa has a much younger population as a whole, including Nigeria, in terms of our population and our mean age. And so the deaths worldwide have been over 1 million already. These are humans and lost lives. In the US alone, over 233,000 people have died. In Nigeria, like the First Lady mentioned, over 1,000 people. But what you can see is that the case rate, the burden of disease, and the fatality rate is very different on the continent of Africa and in Nigeria. So why is that? And people have postulated why is the burden lower in Africa? Why is the case fatality rate in Africa as a whole a little lower? And we were all worried when the pandemic started what that would mean with the infrastructure and the populations in Africa. No one knows, and I'm not going to spend a lot of time on this slide, why that is. But it's probably multifactorial. So when we look in infectious diseases and we see differences in outcomes among populations, we say it's either the environment, it's either the virus, or it's either the host. There's only, or you have an intermediary host that is not present. So it's either the environment is not hospitable to the virus, or the virus has mutated to a weaker form, or you have something where the host is not easily infected, or the host has mutations that allows them to have a milder disease, or you have something where the virus is just not able to get into the host. So why is that number much lower, where we have millions in other countries and a lower burden in Africa, and then specifically in Nigeria? Well, one of the things is that we have a younger population overall. It's been mentioned, the median age in Africa as a whole is 18 years. I found that surprising, but I have a reference for that, so I know it's legit. And only 2% of the population is over 65 years in Africa as a whole, compared with 40 years and 47 in North America and Europe, and where 15 to 18% of the population is over 65 years. So that could contribute to the lower rate in Africa. The of this virus to survive. When the virus is in Nigeria and Africa, is it mutated into a form that is less virulent? Is it because of prior immunity to similar viruses? There's thought about higher baseline rate of chloroquine use. Is there some of that? We do know that this virus specifically needs this receptor, this ACE2 receptor, to attach to the lung cells and other cells. Are there differences in susceptibility and expression of that receptor that the virus needs? We know that there are genetic polymorphisms that differ by region. So it's probably a whole bunch of other things. Or do we have better quarantine and isolation measures? Are there better adherence to masks and face coverings and hand hygiene? People have said, is it just a lower case reporting rate? Yeah, it's possible, but then you would still have mortality that would be unexplained. Is it lower testing rates? Possibly. But again, if people are ill and dying of it, even if you have lower testing rates, you would have seen a spike in mortality. So overall, it does seem that we have lower case rates, lower mortality rates, and it's probably a bunch of all of these factors. And I know that people working hard on that in Nigeria and Africa, looking at that. What we do know is that there are more people in certain parts that have been looked at in Africa who have asymptomatic disease. So it looks like even when people get infected, they have a milder course of this virus and maybe less likely to transmit. But that does not mean that the next wave, if it happens, is going to play out this way. And it doesn't mean that another outbreak will continue to look this way. So it's important to stay prepared. Our numbers are lower than what was projected, but we really don't know why that is. It's a good thing, but we need to stay prepared. So what are the risk factors for people who are diagnosed with COVID or hospitalized with COVID? Older age. We know that age over 60, for every decade over that, the mortality rate is much higher. Doesn't mean that young people don't die, but the age is a big predictor. So is having underlying comorbidities like heart failure, hypertension, kidney disease, asthma, COPD, diabetes, and obesity. And I mark all these out because these are things that a lot of our speakers will talk about. And Toyin being a fabulous geriatrician, Dr. Ajala, these are things that she manages. And so it becomes important looking at this risk, if you have these risk factors, to have these conditions under control, because that really helps you if you do get COVID-19 to have a better outcome. Obesity and morbid obesity is a really big risk factor for a poor outcome with COVID-19. And I put this one slide up, and I know that Dr. Silao, a colleague of mine, is going to talk about the importance of physical functioning, but obesity is associated with a lot of immune dysfunction. And with that also a lot of comorbidities, heart disease, kidney disease, and all of these things. It's associated with a chronic inflammatory process. So if you think of obesity just being a risk factor for so many cardiovascular and other outcomes, and then you add an infection like COVID-19 on top of that, you can see why obesity by itself is a really big independent predictor of death with COVID-19. The other part I want to get into before I round up is the chronic or the longer term effects in COVID survivors. So a lot of charts talk about infection rates, asymptomatic infection, and then talk about death. But there are people who survive COVID-19, and most people will survive COVID-19. But what we're starting to see is that there are chronic and long-term effects in survivors. And now, the first case was described in December of 2019. So we're not even a year into this. So we don't know how much longer these effects will last. But what we do know that for people who've recovered weeks to months, a lot of things, including fatigue and shortness of breath, lung damage, heart involvement, neurologic complications, a lot of things that we see as people get older, but even in young people who've recovered from this virus, some of these things, a long list of things, including survival skills for people who don't get infected or who have family members who die. So it's very important to know, but the financial impact on employment and productivity with these longer term outcomes, and also the potential impact when these become pre-existing conditions. So I'm glad that Dr. Ajala has
That's just claustrophobic.
I'm glad that Dr. Ajala has a panelist to talk about finance and the importance of mental health and physical health, which are all very important. COVID-19 was the rave of what we talked about in 2020. This just shows there were lots of other outbreaks, and I'll go into them because while COVID-19 was going on, the CDC and other places were tracking a lot of other outbreaks. We don't want to forget about the common infections that are still going on. So hepatitis, HIV, this is what I do, I'm an HIV doctor. Hepatitis, those are chronic and long-term infections that are really ravaging and we can test and treat for. So it's very important not to forget, as we're talking about COVID-19, the other infections that are really having a global impact, especially in Africa and Nigeria, complications of hepatitis, HIV, TB, and malaria. So the immune system this is Dr. Ajala's forte, and why age is really important. And I'm glad it was mentioned that the aging process starts at 30. So we hit our peak and then things start to decline. We can change the trajectory of that and make the slope a little different with the kind of habits and things we're going to talk about today, both at the main sessions and the breakout sessions. But this just shows that as we age, our immune function changes. So our adaptive immune system, our innate immune system, things start to go downhill. The ability to produce antibodies, the ability to fight off infections. In addition to that, even seeing things like our skin, which is our biggest barrier to infections, with aging and thinning of the skin and things like that. So it just becomes important to do things earlier that kind of prepare us for that aging process, which is inevitable but we can change the trajectory of how that happens. And this one slide is for anyone who's an immunologist, this is like an immunologist like dream to go into all the cells. And I could do a whole lecture on that, but this is just to show us that there are things that are going to happen as part of the aging process, but we can attenuate that process. Some of the infectious diseases that cause morbidity and mortality in the elderly, we talked about COVID-19, but in addition to that, influenza, pneumonias, urinary tract infections, and we talked about complications of hepatitis B and hepatitis C, just as a few of them. So there will be more emerging and re-emerging infectious diseases. That's clear. Why is this going to happen? When will it happen? We don't know, but it will happen because of the co-mingling of what we do as humans and these pathogens, right? There are deliberate things we're doing to the environment, deforestation, we're moving more and more with where animals and humans are living, we're moving, we're deforesting, there's land misuse, there's mosquito-borne illnesses, antibiotic resistance, another thing that's an issue. So changes in climate, there are lots of things. And with global air and high rail traffic, an outbreak anywhere is an outbreak everywhere. And that, well, we saw that from Wuhan, China, to everywhere in the world within a couple of weeks to months because of travel. So when will the next pandemic hit? I don't know. But what we know, it's probably not going to be another 100 years before it happens, because when you have lots of people, when you have diverse plants and animals, and you have rapid environmental changes, that's a nice mix for when the next pandemic will hit. We know that there are over almost 2 million undiscovered viruses that exist in wildlife, and many, many infectious diseases have broken out over the last 3 decades. And you can remember a lot of it's from animals and humans, camels, horses, pigs. And we know that the next outbreak is predicted to come from birds and poultry and things where you have a lot of poultry and humans. So what are some of the watch, Toyin wanted me to, Dr. Ajala wanted me to talk about what are some of the things the CDC and WHO are looking at. Ebola, Lassa fever, we've seen little outbreaks, but could that be a pandemic? SARS, we've seen Nipah virus, Zika virus. So these are kind of the top 10 on the watch. And we know that more could be added to that over time. So what can you do now? And I like to leave on a positive note. So we know that when there's deforestation, when there's a lot of travel, when there's an outbreak, even in a small remote town with air travel, that could be a disease anywhere. What can you do now? We need to optimize our health, physical, mental, social, emotional, spiritual, but also now financial health, because health is not just absence of disease, right? It is presence of physical, mental, social, emotional, and spiritual wealth. So we can build up our cellular aging. You want to get exercise, and Dr. Salah will talk about that. Maintain a healthy weight. I know we have Dr. Kavi, and we have people on here who will talk about how to do that. Really building up our immune system to prevent any kind of poor outcomes. We don't want to forget about getting screened for HIV, hepatitis B, hepatitis C. These are global things that affect our continent of Africa specifically. And we really need to do a good job about screening and access to care, keeping up to date with health screenings and preventive care, getting our vaccinations for flu, pneumonia vaccines, and any of the vaccines that your healthcare provider recommends, safety measures. I mean, this slide is what Dr. Ajala does and more around preventing falls and injuries, because a weak immune system will slow healing, and then good heart hygiene. It's important to have a continuing relationship with your primary care physician, not just when you have an illness or when you feel unwell, because some of those diseases we talked about, hypertension, diabetes, may be asymptomatic for a long time. So it's important to have an established primary care physician and have a good relationship with them. As we get older, or at any age, it's important to have a health advocate or navigator, somebody who's doing your healthcare journey with you. Having an advanced directive form, a surrogate decision maker, is very important. Something we don't necessarily like to talk about, especially as Africans, but it's important to do that, to have a clear advanced directives form, a surrogate decision maker, and really looking for where you get your information. With technology, we have a lot of information, but there's a lot of myths and misinformation that get perpetuated when things are desperate, periods of uncertainty that can actually harm. There was a lot of harmful things that were going around COVID, and it's really important to figure out where you're getting your medical information from. Okay, and done. The world gets smaller and tinier every day, and that means, like I said, an outbreak anywhere is potentially an outbreak everywhere. We can use technology to our advantage all the time, looking at health apps on our phones, tele visits for medical and mental health visits, tracking our share results seamlessly. It's important to okay. Okay, I'm getting okay. Is it possible to
can you mute your mic, please? Somebody is speaking. Can you mute your mic, please?
There are about 3 people talking. I'm almost done. So it's important to use technology to advantage. So this kind of technology to be able to join virtually where you can get quality medical information. For those of you who already joined, you made a wise decision to attend this conference by JBS Medicare Services, subscribing to sites and outlets that have credible professionals, and using technology to advantage telehealth, tracking our vaccinations, making clinic appointments, medication appointments. These are ways where we can use the same technology to advantage to optimize our health. Again, this last slide just showing that the world is small. With travel anywhere, any of these diseases in a small outbreak could become a pandemic. And it's important to know that with an infection anywhere, it can be anywhere. So for the next pandemic or epidemic, we will need the expertise of human health, animal health, environment. They're all intricately connected. Coordination of public health efforts across many continents, as is happening right now. And you're going to need a healthy host, which is yourself, and priming yourself for that next epidemic. So this is how we can prevent and protect ourselves. The CDC and WHO have slides. It's important to mask up. It is the one thing we can do right now. Mask up, maintain social distancing, physical distancing, wash your hands, hand hygiene, get your flu vaccine, and just be ready. Get your health ready. And this is a slide I just put up that no matter what you're doing, getting your vaccine, voting, doing the shop, whatever you're doing, mask up, because it is what you can do. It is the biggest effective thing we have right now against COVID-19. And so mask up, wash your hands, social, physical distancing, flu vaccine, healthy nutrition, exercise, and the experts on this call who will do that. And I have these 2 quotes. You may not be able to control the pathogens. We can't control the changing environment, but you can control what the pathogen has to do to take you out. And that's optimizing your immune system. And getting your immune system in prime fighting shape is what we can do to prepare for the next epidemic. These are some of my references. And if you guys love Fareed Zakaria, he has a new book out that I absolutely love, 10 Lessons for a Post-Pandemic World. And the WHO and the CDC have amazing references. And with that, I'd like to thank you for your attention and hand it over back to our moderators.
Thank you so much for that amazing, very insightful presentation.